listen. I too am very awkward on stage. Can you hear me? I'm kind of soft-spoken. Okay. So, my name is Jana. I've been saying 15 years experience, but it's probably closer to 20 now. I'm in denial. In trauma ICU mostly, as well as GI, bronchoscopy, most recently recovery room and GI. That's where I was working last March when all this started. Was in an outpatient facility in a hospital. All our patients were coming in electively, so getting their PCR test before they came in, and it was this big panic. They couldn't come back if they didn't have the test, and everybody had to wear their mask, but there was no kind of regulation on what type of mask they could wear, and I was noticing all these dirty masks coming in, women with makeup all over it, and I think that's the beginning of my sort of awakening. I've always kind of questioned things as a nurse, like I noticed in all these screening type procedures, we weren't really doing much for people, but because I was working trauma, I think I felt like we were helping people. But once the population was supposed to be masked, that was when it was like totally woke up to this, like this is not right. So I started speaking out against it, and for the first time in my life, I was bullied at work. It was interesting. It's just not okay to think differently from the status. They brought in all this fear, and I'm sure you saw it, the videos from China, the people dropping dead, the ICUs, and everybody in their PPE, and so they sort of traumatized healthcare workers, and then it just like blanketed them with fear and told them there wasn't enough PPE, and I think that was kind of their evil, brilliant way of controlling, because once you control the perception, you control people's behavior. And everybody just wanted those masks. I remember people calling me, do you guys have masks on your unit? Like everybody wanted to stash masks. And so like they made the scarcity. It's kind of like what they're doing with the vaccine right now. Only certain people can have it, so it makes people want it more, right? And I fell for it too. I was scared. I remember calling my friends in Canada. I'm from Canada. I'm like, do you guys have extra N95s you can send me? I'm like, no, they're all locked up. It's funny now, like, it's pretty ironic though, because I wouldn't get the flu shot, so when I came down here, I had to wear a mask during flu season, but I was the only one because I didn't get the shot. And then when this happened, it was like, you can't wear the mask, we need the mask. I was like, okay. But then I wanted the mask, because this big scary thing was coming. And then it was, like I said, when people were having to be masked, and it could be like a sock, and you were seeing all those videos. Like, I started to think, and I was like, and I also have a background in yoga. I teach yoga, and I've been working on a health coaching business, so I've been into the holistic health, but this has like really propelled me to see the importance of it, and that's what I've been working on. So finally I decided I couldn't go in and perpetuate this just culture of masking, and I didn't want to impose it on people. So I told my manager, and I told them that I wasn't gonna wear a mask anymore around healthy people, and I'll wear it around sick people, I'll wear a visor. So they let me go. So that was the first job I got fired from this year. And then actually today I was just let go from my ICU job. So how's that for timing? It's funny though, because I was actually laying in bed last night, and I know I bring home this really dark, dense energy from the hospital, and I have this really sensitive 10-year-old, and he feels it, and he's like, can we sage and everything? And he had a really rough night last night, and I know it was because of what I had gone through, and we were very connected, and I was laying in bed like, oh, should I just cancel this? Like, I've already seen it. Like, the reason I took it was because I wanted to like have more credibility as a nurse, because I've been very outspoken about it, but all my nurse friends are like, well, you haven't seen COVID patients. You haven't worked with COVID patients. So I took it, now I have, and now they let me go, so it actually worked out really well. And it's fun that it happened today that I'm speaking about it. So yeah, I was lying in bed last night thinking I want to cancel it, and then I got the message today that they canceled you. And there's a few reasons that I can think of. When I first got on the unit, I just wanted to soak it all in, like what is going on? Because when I left the hospital, it was just this bizarre, weird, doctors were double masking and everybody was scared and you couldn't bring anyone back without a PCR test. And I was telling people, did you guys know about the cycling of the PCR test? And have you heard about Carrie Mullis and how it's not supposed to be diagnostic? And they would just kind of blankly stare at me. I talked to the infectious disease doctor about it and what he had heard about, cycling it and how Fauci says it's even dead nucleotide and it's meaningless. And this is what we're basing this case-demic on. And he just looked at me straight in the face that none of what you said makes sense. And he's the infectious disease guy in the ICU and throughout that whole hospital. What else did I talk to him about? Yeah, he said the PCR is the gold standard. Oh, and the vaccines. He's telling everyone that that's the only way that this is going to end, the vaccines. And that is the culture there, and I think that may be why I was let go, because I had the conversation with a couple different charge nurses that I was the control group when they asked if I was getting the vaccine. And I don't think they liked it. I also was wearing like a mesh mask. They let me wear whatever mask I wanted, which was cool. So I got one of those like colloidal silver mesh ones that Judy Mekovitz talked about. And I wasn't wearing the N95. They all wear these poppers, like PAPR. It's like a hood, and then it hooks up to some kind of battery pack. I don't know what the air is. And so they all like put this on, and then they go in the room, and then there's signs up in the bathrooms. It's like you can use your PPE, so your gown and your gloves are interchangeable now between patients, as long as they're COVID. But everyone's COVID. That's the thing, and it's like there's no more MRSA, there's no more VRE, there's no more C. diff, there's no more flu. It's just COVID, and it's not even based on the PCR. It's based on, it could be an antigen test, it could be symptoms, it could be an X-ray, it could be PCR. So there's no standard. Anyway, I've kind of like gone way off my notes here. Let's see. So they are busy there. There's a lot of sick patients. It reminds me of back in the H1N1 days, 10 years ago. I worked actually at that same hospital. People come in, they lose their reserve. It's people that are obese and diabetic are the two main risk factors that I'm seeing. They are given remdesivir and convalescent plasma, and it's been really, really busy, so I really wanted to kind of dig back into the charts and see what was going on. But from what I could see, it was like sort of a one-time thing that they give it in ER, and then that's called treated, I guess. And then they're put on a BiPAP, which is like positive pressure airflow, that it makes a seal around your face and then just like presses air into your lungs. And that's kind of the last ditch effort until getting intubated. And once they're intubated, then I think something like 90% of them die. So that's what they do. They give remdesivir, convalescent plasma, and then BiPAP, and then intubate, and they die. And they blow out their lungs. People are getting chest tubes. Their kidneys fail. So it is like a horror show, because they're stroking out, and you walk around the unit, and it's just like these brain dead people, and it made me think of like the people that are trying to control us. It's all about like siphoning our energy, right? Like when we're in a high vibrational state, like we're above that, but it's just like this low fear, dread, like that. It's just kind of like this energy vortex. And I think that's why I'm like grateful that they let me go, because I was like, I can't go back to that. Like I've seen it, okay, I'm done. But they're not getting the treatment that many doctors are speaking out that actually work. So it really is like genocide, and it is certain demographics that it's like pretty in your face when you see it. It's almost like been engineered to get these people. And so, why would you censor hydroxychloroquine, ivermectin, things that actually have been proven to work? And the only reason that I can see is because it would cut into the profits of the $1 trillion whatever vaccine industry. So it's pretty horrific. Let's see. What else was I going to say? It's interestingly enough, the doctors, and it's the ones that I feel like were the sharpest, like the surgeons, or there's one particular doctor who was like really outspoken and really passionate, and I could tell he really cared. I mean, they care. They're just stuck in this. It's like an echo chamber. Have you guys heard the term echo chamber? It's let's see. I wrote down a definition. Situations where beliefs are amplified or reinforced by communication and repetition inside a closed system and insulated from rebuttal. So it's not accepted, and I think that's perfectly what is going on. It's not acceptable to question things. When I had that chance to talk to the infectious disease doctor about the PCR and the treatments, it was like, and I asked about hydroxychloroquine, and the answer really quick was, oh, that's a conspiracy theory. Like that, it just is. Like, it was clear he'd never looked into it. It's a conspiracy theory. And I also heard him talking with his colleague about, I'm like a little spy just listening, about how a patient had left AMA against medical advice, and they were laughing, oh, he says he's gonna go take ivermectin, And I don't know if you've heard of that, but it's an antiparasitic, and hydroxychloroquine as well. They both stop viral replication in the cell. So when they're taken early, then it's very easily treated. But they were laughing about this patient who left and was taking ivermectin, and I was thinking to myself, like, he's not here though. He's okay. Like, he's not like one of these. And just the treatments that they're doing, so patients are put on a vent, and they're so used to everyone just dying that they're so demoralized. I gave a report last night. I had a patient, he had been on BiPAP since Christmas Eve. He was one of my first patients when I started there, because I was only there for about 4 weeks. And he couldn't, if he took off his mask for more than like 30 seconds, his SATs would be like in the 40s, 50s, and he'd get really anxious, and we put it back on. And so I was trying to get nutrition into him, because you can't, like, they weren't feeding him, they weren't really giving him IV fluid, they just give sedation. So sedate them for the anxiety and put them on oxygen, and then they just waste away, like fungus feet and bed sores. And anyway, so I was trying to like feed him, and I got a call from, this was one of his first days, I got a call from dietary, and she's like, is he able to drink Boost? Because I kept sending Boost. She's like, okay, I'll just put some ice cream in it, because that'll give him the calorie. So if he drinks 3 ice cream shakes a day, that's enough calories to get him through. So that's how they were nourishing the patients. And the tube feeds, I think the first ingredient is like high fructose corn syrup or something. And these are things that when I work trauma, it's the same stuff we were using, but it's just, I feel like I'm seeing it from a different angle now. But this poor man, I wanted to bring him a smoothie, and then anyway, I had him again yesterday, and it was like, it had been a few weeks, and he was still fighting, like he was just, but his mouth was completely caked with this Boost stuff, like all over his teeth. And like all I wanted to do was like get in, I took a cloth and was trying to scrub it. There wasn't even a sponge or a toothbrush in the room. Like no one had ever, I asked the RT to help me with mouth care, and she was like, well, it's not gonna get any better, he's just gonna die. It was, I mean, I don't want to say they're all bad people, I don't want to, but then they are busy, but it's like, this is not humane, like this is sick. They're just getting so demoralized, and when I gave a report on him last night, it was, oh, I can't believe he's still on the BiPAP. They just need to intubate him so it can just be over. And these people are rotting away on the vent, but they have to, I had a patient last week with a couple chest tubes because he had a pneumo. They blow really high pressure oxygen in, and then sometimes their lungs kind of burst and they get like bleeds in there. And so we put chest tubes in and we prone them. So we like wrap them up in a blanket and everyone comes in, and then we flip them around, and so they're laying on their stomach for 18 hours, and then we flip them back. And it's supposed to help, but like nobody's getting better. And I remember doing this back in H1N1 too. It's to help with recruitment, and the lungs are up, and that's the theory behind it. But the men's like penises are all getting pulled, and like ulcers there, and then ulcers on the coccyx. It's it's pretty nasty. So I had this one patient was clearly deteriorating, and the doctor. This is an example of like sort of gaslighting, and how they just kind of go along with what's being said. And I asked if he's clearly getting worse, and he had a new chest tube anteriorly, and he had orders still to prone him. I'm like, do you still want to do this? Should we still be doing that tonight? He's like, well, it's working. And he kind of like was looking around like it was working, and all the patients were dying. So I thought that was a good example of how twisted it really is. So I'm grateful that I don't resonate with it there, that they let me go. I definitely believe that fear is the driver of the virus. We have patients come in that, for diabetic stuff, but then if they have a positive PCR or if they happen to have antibodies, then they're put in a COVID room. And then because they're just like, all the staff is wearing the same gear all day between COVID patients. There's so many things. I made little, let's see, so this past year, since sort of like waking up to all this, and I've studied a lot more this year about the history of medicine and germ theory, and how germs have actually never been proven to cause disease or contagion. They've actually never isolated this virus, which makes you wonder what is in the vaccine. Synthetic gene therapy. So I now believe that it is the accumulation of toxins in our body through diet, chemicals, and drugs, and even toxic emotions like fear and trauma. These are what cause disease. The symptoms that doctors call disease is actually the body trying to excrete these toxins from our cells. So when the toxic load is heavy, the detoxification or disease process is more intense. That's why it's people with sort of metabolic disorders that this is a lot worse in, like obesity and diabetes, and kidney problems too. So this is why I keep talking about how important it is to take an active role in our health. We can no longer be passive in our health. We are literally under attack. We have to be mindful and conscious in every moment of how we're living our life and what type of energy we're bringing in. And that's also why I know it's a blessing that I was canceled from my contract, because it was bringing me down. One of my favorite doctors, Dr. Christiane Northrup, said, in order for any wound to heal, it has to first be witnessed. So for me, this was like witnessing the wound and the darkness. It was literally the belly of the beast. I've seen it now, and I don't want to put my energy. I want to put it towards freedom, connection, love, autonomy, sovereignty, empowerment. And when we do this together, like we're doing right now, we are exponentially more powerful. So I just invite you to hold the vision of what you see coming. Letting this go, transmuting this. This is not resonating with us. We are creating a new future right now. And yeah, I think I'm sure there's more I was going to say, but I've run out.